Okay, good morning everyone. So I am Dr. Dinesh. Am I audible? Confirm the audibility and visibility. Okay, good morning everyone. So I am Dr. Dinesh. Yes, so today we will discuss about medical devices drug inspector, which is going to conducted by CDSCO, and also it is very important, and after long time they are conducting specially medical device post, and the syllabus which is related to confined to the few topics. So initially the syllabus was different. They have incorporated engineering syllabus and other things, but today we will discuss about the detailed syllabus of medical devices drug inspector, and what are the important parts we need to cover in this examination to clear. And this is a central examination, remember, so all are eligible for this. And another thing is, how many posts are there, okay, what is the eligibility, and in detailed medical device rules 2017. So if we see the detailed syllabus, okay, detailed syllabus, if you see this, then first they have given only current issues of national and international importance relating to, there are four categories, okay. So number one, environment, and number two, social and economic, number three, and industrial development. So this is the first point we need to cover, current affairs, okay, current affairs, right? In this again there are four different parts. And then another thing is basic knowledge of computer applications, that also we will teach. And then English language proficiency. So this was there every examination of UPSC, initially also, now also it is there, and we will also teach that also. And the another important point, reasoning ability and quantitative aptitude medical device rule and 2017. So main ga ikkada reasoning and qualitative aptitude. So this is very important related to mathematics, okay, reasoning and aptitude. This also will teach. And another important syllabus related to pharmacy. So among all these points, the only point is related to pharmacy is medical device rules 2017. And the last one is general science. So here I want to tell you all, syllabus is very broad, okay, syllabus is very broad, right? So, and this is the first syllabus which is given by UPSC for pharmacy exams, very confined, right? And the pharmacy point, they have mentioned only one point, that is medical device rules 2017. So here is the key point you have to follow, how to cover the medical device. I am coming again back to the media, so to train you for the drug inspector post, right? And also I have experience in training of pharmacists, GPAT, NIPER, all the pharma competitive exams. And even though all other entrance exams, like even though in drug inspector exam, Telangana used to have the paper one, that is general studies. Okay, I train students in that area also. So with that experience, with the for this medical device post, I will give you detailed information, overview of the detailed syllabus. And there are various faculty with us, okay, so those who deal with the different subjects. So we have faculty for current affairs. I am not the master of everything, okay, I deal only with the medical device rules, and some of the other pharmacy faculty deal with the medical device rules, and some of the I requested some of the DIs also, so those who are working in CDSCO, they also come and take you the medical device part, okay. So that's how I will bring all to one point, so that you will crack, it will help you to crack the exam, that is central government exam, central government drug inspector post, especially medical device, okay. So here we have the faculty from current affairs, okay, and in the current affairs there are various subjects, and the experts will teach in their own subject. and English faculty also we have today, and they will also tell you how to read this current affairs in different parts, and English faculty will also teach you how to prepare for this exam in this UPSC level, because they have vast experience in competitive exams of other examinations also, not only pharmacy. So they will also come in live, and they will also take the class, especially current affairs and English and general science. So we have multiple faculty, and they will take classes based upon the availability. I will give you the entire schedule of the coaching. So we have only 2 months maximum. Okay, not 2 months. By September, October, November. November 2nd is the exam. Okay, so by October 20th we will finish the syllabus. Okay, I will give you entire map of the how we will go through with the different subjects. Okay, and from October 20th onwards we will conduct mock tests. Okay, mock tests and paper discussion. So this entire 10 days will go with the exam preparation and paper discussion. So this is the map, and I will give you in detail map also, day wise syllabus, and particular subject wise how many hours we will teach and how much part we will cover, and especially medical device rules. This is a confused subject for everyone, even though for the medical device officers also, because which comes under medical device, which will not come under medical device. Okay, it is new rule. Okay, which is passed in 2017. So that's why we need to have a clarity. Okay, we need to go through the syllabus of medical device rules in detail. Okay, and how we'll apply, what are the different parts of the application. Okay, and what are the forms, important forms. So we cannot read entire gazette. Okay, it will confuse us. So I will teach you medical device, and some of the other faculty also will teach medical device. And now I invite my great teachers. Okay, so they will teach you current affairs and the general science and general English. So please welcome, sir. Yeah. Okay.
Hi, this is Somshekhar Reddy. I teach current affairs from last 25 years. In your syllabus, I cover only 2 topics. Actually, what is first topic in your syllabus? That is current affairs, international, national importance of environment, social, economic, and industrial importance. These 4 topics mentioned in current affairs part. I deal socio-economic current affairs. What are socio-economic current affairs? First we have to know. After that, what type of questions are possible to ask generally in competitive examination. Your examination point of view, any particular blueprint is not given. It means model question paper is not given. That's why I observed so many competitive examinations in India. What type of questions are possible to ask? I will tell you. Socio-economic current affairs means anything is possible. Society means in this world anything is possible. Economic means particularly some topics are there. That's why first I will tell you economic current affairs, what are there. Indian economy. Mainly we have to focus on Indian economy. If you write any Indian competitive examination, we must concentrate on Indian economy. In Indian economy also very vast syllabus, but generally general awareness or general studies point of view, some topics are covered. Current related only we have to concentrate. Entire macroeconomics, microeconomics are not necessary to read for current affairs point of view. Only just you concentrate some important. Suppose our planning system. Indian planning system is present based on Niti Aayog. Our plan is prepared by one advisory body. Previously, Planning Commission designed our plan. Present our plans are designed by Niti Aayog, National Institution for Transforming India. That organization was established in 2015. That organization designs our planning system. Who is present chairman of our Niti Aayog? Always Prime Minister is the chairman of Niti Aayog. Or who is the deputy chairman of Niti Aayog? We have to know. Or vice chairman of Niti Aayog. Who is CEO of Niti Aayog? Who are the permanent members? Some scientists are there here, permanent members. Some agriculture scientists are there. Economists are there. Doctors are there. Different people are members in Niti Aayog. All different category people are sit one place and designed our plan. That is Niti Aayog. According to Niti Aayog advice, our government followed planning system. That's why first we have to know current affairs point of an economy, our planning system. Previously we implemented 5-year plans, but present situation we are implementing 15 years plan. Narendra Modi government is implementing 15 years plan. That's why we have to concentrate planning system. After that, budget. We must know budget. 1 year revenue and expenditure list is called budget. How rupee comes to our government account, how rupee goes from the government account, all these things are explained. Annual financial statement. Budget is nothing but what? Annual financial statement. 1 year revenue and expenditure is mentioned in our budget. That's why we must, whenever you write any competitive examination, current affairs mentioned, economic related current affairs compulsory, must concentrate budget. It means 2025-26 budget we must concentrate. And also economic survey. Whenever government wants to prepare budget, compulsory government must announce 1 day before a budget, that is economic survey. India's economic survey also we must study. Our GST system is very famous in our country. Unique tax system is implemented in our country in 2017. Then onwards, we have been following GST. That's why we must concentrate on GST. But entire taxes are not necessary to know. Whatever taxes are in current affairs, those taxes we must concentrate our examination point of view. Suppose GST slab rates just 2 days back changed. That's why we have to know what are slab rates are changed, who is the GST chairperson, and also GST council who headed. All these type of questions, general basic questions are possible to ask. Suppose if you write civil service examination, we have to study depth in economics. It means in an economy. But general point of view, very basic concepts we have to know. Our central government schemes also we must concentrate. Narendra Modi government or this NDA government has been implementing so many, more than 70 schemes have been implementing in our country. But some important schemes, Pradhan Mantri Jan Dhan Yojana or Mahatma Gandhi National Rural Employment Guarantee Yojana, some important schemes whatever are there, government welfare scheme, those schemes we must concentrate. And also our banking system. What is repo rate, what is reverse repo rate, what is CRR, what is SLR, basic things. A person wants to establish a bank, how much investment is required, all those basic things are required, but current point of view, what are rates, bank rates are there, those things also we must concentrate. Another thing is industrial economic related things also there, separate topic is mentioned, industrial development point of view, that's why we have to consider that one also. But these are main topics we have to cover in economic current affairs, economic related current affairs. What about BRICS? Recently, BRIC name is changed to BRICS Plus because some countries were joined. BRICS means Brazil, Russia, India, China and South Africa. These 5 countries formed a group that is called BRICS. Recently, some other countries were also joined. That's why its name is changed to BRICS Plus. These are socio-related issues we must cover. Recently, BRICS Summit where was conducted, may be possible to ask question. Or G20 summit where will be conducted next in the month of November, we have to concentrate. Or Commonwealth, what is Commonwealth? Commonwealth, formerly British ruled countries, some countries formed a union that is called as Commonwealth. That's why socio-related current affairs means international level, international summits, international meetings, all we must concentrate. After that, some awards and prizes also related to socio issues. Award. What is award? What is prize? So many awards and prizes are there. If a person worked on a one, concentrate on one particular area or particular field, that person is eligible to get some awards and prizes generally. Award gives for a single achievement or lifetime achievement. Prize gives a single achievement or lifetime achievement. Suppose for example you take Bharat Ratna award, our country's prestigious or highest civilian honor, that is Bharat Ratna. Any human being is eligible to get that honor, Bharat Ratna. Suppose Yuva Vignan, in science and technology, Vignan Yuva, previously these awards were called Shanti Swarup Bhatnagar awards. Young scientists below 45 years, young scientists eligible to get that honor. Maybe you are writing exam also scientific related, that's why science related awards also we must concentrate. Socio related awards, science related awards, technology related awards, different awards are there in this country, in this world. That's why international is also mentioned. That's why we must concentrate international level also. Next, sports and game. These are also related to socio current affairs. Sports point of view also we must concentrate. Then technological related current affairs also compulsory concentrate. Different current affairs are there. Some persons came into news. It means some people are appointed from different socio level posts. Some people are died. Those people also we must concentrate. Some places came into news. Some summits are conducted. Some earthquakes are occurred. Tsunamis are occurred. Any major accidents are occurred. At the time we must concentrate those places also. That's why current affairs means particularly syllabus is not given. Any exam you write, just to mention current affairs related to national international importance. At the time this syllabus is very broad. That's why we must concentrate all topics. International organizations, summits and meetings concentrate. Awards and prizes we must concentrate. Sports and games also we concentrate. Our space technology, our nuclear technology, our missile technology, our defense related issues. Computer purpose separate topic is mentioned in our syllabus. That's why basic knowledge of computers also required. If you want to write examination, if you want to prepare seriously, you must concentrate all concepts, because your core subject is only one topic is there, remaining 5 subjects are not even related. That's why whoever get more marks other topics, then they are possible to get job. That's the most important thing. But your core subject is maximum syllabus is there. At the time you concentrate less on general topics, but your topic is only one, remaining 5 topics are general topics are there in your syllabus. That's why you must concentrate other topics also. 1 mark also can change. 1 mark in general studies, 1 mark is also possible to get very tough and also change life also. 1 mark easy to get job, 1 mark easy to lose job. That's why you must concentrate. You have to concentrate. Economic current affairs means budget compulsory concentrate, Niti Aayog compulsory concentrate. Planning system is not required because planning system, 5-year planning system was stopped. Present whatever Modi government is implementing planning system, that system we have to concentrate. Economic survey we must concentrate. Finance commission report we have to concentrate. And also what about our national income, per capita income, okay, GDP, present GDP, how to calculate GDP, how to calculate GNP, all these things whenever we concentrate, definitely we get good score in first topic. Okay, others are will take environmental and industrial current affairs, others are will take, because whoever teach general science, that person can teach very easily, that is environmental current affairs. These are the my related topics we have to concentrate. These we will discuss in our future classroom all these topics one by one, one by one. Just I have given idea today only. Thank you. Okay.
Yeah. So that was the current affairs topic. So that's how we teach current affairs in detail. Okay. And sir will teach only 2 topics among all 4 topics. That is environment and industry. So environment and industry will taken by other faculty members. Sir will teach only social and economic parts. Okay. So in this way we will cover entire syllabus by experts. Okay. All faculty, those who have the expert in their own subject, they will come and teach you the topics. Okay, so now another topic also there, general science, and another logical and reasoning and aptitude also there. Okay, and English proficiency also there. So here again we will talk about English proficiency. See, if we talk English means okay, everybody is reading English, everybody know English, right? Right. So we talk like this. I teach English, I eat English, I speak English, but that will not work out in the competitive exam. Okay, in a stipulated time, how your brain is analyzing, how you are able to answer to the questions. Sometimes silly questions, but we are unable to answer. So each and every mark will decide your job. Okay, each and every mark will decide your job. So in this syllabus, again I am focusing. So there are certain points. Among all points, our pharmacy related only one point is there, but remaining all points belongs to non-pharma. Okay, I don't know how the question paper will come. Okay, but our expectation based upon my experience from last 15 years, I will try my best to convey each and every topic in a competitive manner. Okay, so that's what I am trying to tell you. And now I invite our English teacher. Okay, he's a great teacher in English. He taught many famous UPSC entrance exams. Okay, and he will discuss with you how to get the score in English subject. That is very, very important. Okay, so you have seen various already you have attempted various exams in previous years. Okay, you got the idea how we will lose marks in the general, because these type of marks everyone will get. Okay, everyone will get this type of marks. If you miss in this kind of area, then you will lose the marks and you may lose the job also. That's why I encourage. I created a platform to all the faculty members, those who are experts. Then they will come and they teach you in their own subjects. So even though that may be tough, see the difficulty is medical device schools. Okay, that is difficulty for everyone. But these kind of subjects, English, okay, logical, reasoning, everybody knows. Okay, everybody will do the best. If you are not doing best, you lose the marks. So that is my strategy, and I will train you in a these whatever the stipulated time is there. Okay, in that time I will plan your schedules. Okay, I'll invite faculty, right, and we will also conduct every 3 days we will conduct one exam. Okay, based upon the syllabus, whatever we will finish, we will conduct the exam, and we will also try to do paper discussion, which is very, very important in the competitive examination. Yes, you know you are busy with the job, you are busy with the other works. Okay, forget about that. So follow our channel, follow our videos. Okay, and we will work and we will help in your preparation. We will also work together, and we will complete the syllabus within stipulated time by October 20th, and then we'll go for the paper discussions and mock test and grand test also. We are going to conduct grand test national wide, countrywide grand test will conduct, and so many aspirants are calling us and sir, please give us syllabus, give us training. Okay, and so many aspirants calling me, sir, how the paper will come. Nobody knows. Don't get worried. Don't be worried about the paper and other things. Whatever the syllabus which is given, we'll start preparing that syllabus and we'll go to the exam. That's it. No need to worry about all these things. And whatever the updates we'll get, we'll be in touch with you in every day. Okay. So now I invite sir to take care to take the English subject. Thank you, sir. Thank you for joining us. Please. Thank you, sir. Yes.
Okay. Right, let me start. Good morning, all of you. Right. This is Venugopal, English faculty for UPSC Group 1 and Group 2. Right. So let us discuss syllabus of Drug Inspector General English. The notification, it is a given English proficiency. language proficiency. There is no detailed syllabus for the subject. Now we discuss entire syllabus for the examination. See, right, English language proficiency. Actually, in the notification, there is no particular syllabus, no structured syllabus is given. So simply, it is given as English language proficiency. So, what is topic? So, some important topics to be discussed here. So, see, first of all, simply there are three topics enter English. First of all, tenses. Second one, parts of speech. Third one, vocab. Parts of speech. Third one is vocab. Entire syllabus classified simply three topics. First one, tenses. Second one, parts of speech and vocab. See, first of all, you must focus on these three topics. You must learn. You must getting more important marks. See, so entire syllabus we discussed here. The first topic is tenses. Since childhood, we learned something about tenses. Present tense, past tense, future tense. What is present tense? Present tense indicates ongoing actions, daily actions, just finished actions. One past action, one action started in the past and still continuing, then type of action also comes under present tense. See, so tenses are mainly three types: present tense, past tense, and future tense. Just I have told you, present tense indicates, see, ongoing actions, daily actions, just finished actions, as well as started in the past and still continuing actions. Still continuing. Right. These are actions considered present tense. See, ongoing actions. She is going to call us. I am teaching the lesson. You are listening my class. These are all example considered ongoing actions. See, daily actions. Children go to school. Dog barks loudly. She wears always silk sarees. These are all example for daily actions. What just finished actions? She had just gone away. I have visited Taj recently. These are all just finished actions. These actions comes under just finished actions belongs to simple present tense, present perfect tense, and started in the past and still continued actions. Now you are coaching. You are taking coaching for 6 months. Your coaching started 6 months ago. Now still it is continuing action. So these actions are considered present perfect continuous action. Clear? Simply, present tense indicates ongoing actions, daily actions or routine actions, and just finished actions and started in the past and still continuing actions. Then what about past tense? Yes, past tense indicates the action was completed yesterday, day before yesterday, last year, last month, last decade. So all actions were happened in the past, comes under past actions. Then what about future tense? The action will happen in the future, tomorrow, day after tomorrow, next year, next month, maybe after 10 years, before 10 years, after 10 years. So these all actions must be classified in three tenses: present tense, past tense, and the future tense. Clear? So after every topic finish, I will give you a most important practice questions. And the previous questions will also be discussed here. Practice questions and the previous questions also will be discussed here. Clear? Right now. So, after tenses, the most important topic is parts of speech. Parts of speech. You know very well, there are 8 parts of speech in English. In English language, 8 parts of speech: noun, pronoun, verb, adverb, adjective, preposition, conjunction, at last interjection. There are 8 parts of speech in English. You know very well, sir. The first one is noun. Second one is pronoun. Third one is verb. Fourth one is adverb. Fifth one is adjective and preposition and conjunction, at last interjection. What is noun? You know very well, sir. Noun is the name of the person, place, thing, animal, bird, like that. Simply a naming word. See, say noun is a naming word. Naming word. Example, for example, Ramu, Raju, city, Hyderabad, mango, parrot. A city name or a person name or animal name or bird name, anything else. What is pronoun? Instead of Ramu, we should use he. Instead of Sita, we should use she. Instead of mango, we should use it. So, naming word. Pronoun is a substitute word. Pronoun is a word which is used instead of noun. So, pronoun is a substitute word. Substitute word. Example, instead of Ramu, we must use he. Instead of city, it is used it. Instead of women, we must use she. Girl name. Okay, verb. What is verb? The most important topic in entire English is called verb. Not only English language, any language. The verb is most important topic. Without verb, we don't frame any sentence in English. See, so verb is an action word. What I am doing here, I am teaching an action. What are you doing now? You are listening. Listening is an action. Teaching, listening, running, sleeping, singing, swimming, dancing. These are all actions. Clear? So, verb is an action word. Verb is an action word. Example, write, sing, dance. So many examples. Now, what about adverb? See the word addition to verb. Addition to verb. Supports verb. Suppose, example, she sings. What she does? Sings. How she sings? She sings sweetly. He runs. How he runs? He ran quickly. Quickly. How you write? You write neatly. Neatly. Quickly. Sweetly. So all the words ending with identify the adverb by seeing the ly. Mostly. Clear? So adverb is a ly word. Of course, most of the words ending with ly. That's why ly word. Clear? Example, sweetly, quickly. Clear? Neatly, thoroughly, frequently. So many words are there, sir. Next, what is it? Adjective. Adjective means it qualifies a noun or a pronoun. For example, she is beautiful. She runs very quickly. For example, she is beautiful. She is a pronoun. Pronoun. Beautiful is adjective. Adjective qualifies a noun or a pronoun. Clear. Suppose beautiful is a qualifying word. Qualifying word example, beautiful. Kindness or kind, notness, kind. Brave. She is brave. She is brave. She is innocent. He is kind. She is beautiful. So all example for adjective. So preposition. What is preposition? Yeah, preposition example for on, in, it, with, by, for, since, among, so many words. How can you identify preposition? Actually, preposition, P-R-E, pre. Pre means before. Position. If the word is placed before a noun or pronoun, there is a relation in the sentence. If you know the word, if there is no word in the sentence, no relation among the words of the sentence. See, suppose see preposition. See the examples. For example, the book is on the table. The book is on the table. Here is on is preposition. The cat is under the table. The cat is under the bench. Here under is a preposition. Clear? See, if there is a word on or under, the preposition is used or before the noun or pronoun or, for example, him or she, her, anything else. Is a relation word. If there was, for example, the preposition, the word on is not used here, the no relation among the words in a sentence. That's why a preposition is a relation word. Clear? Relation word. Actually, complete definition is preposition is a word which is placed before a noun or pronoun to show its relation to other word in a sentence. Clear? That is called preposition. And finally, conjunction. What is conjunction? So, junction which combines more than two words. Clear? In English, conjunction which combines two words, two sentences, two phrases, two clauses. The conjunction is a word which connects two words, two sentences, two phrases, two clauses. So that's why it is called a connecting word. Ramu and Sita went to fast. For example, you can write with either pencil or pen, either or. She is not only intelligent but also hard worker. Clear? So conjunction is a connecting word. Connecting word or a combining word. Example, and. Example, but. For example, she is poor but she is honest. Here, but connects two sentences. Clear? Lata and Geeta are friends. Lata, Geeta, these two are nouns. These two nouns are connected by and. Here, and is a conjunction. Clear? Suppose, and is a conjunction. But is a conjunction. Although, though, in spite of, despite. So many examples. Finally, interjection. Interjection is an exclamatory word. It expresses either joyful sentences, sorrowful sentences, or different expressions as joyful or sorrowful or sadness, anything else. Exclamatory word. Example, hi, hello, hooray, alas, wow, shh. So certain expressions, certain feelings. Example, hello, hi, shh. So many words. So they're all example for interjections. So simply, I gave explanation, brief explanation of preposition, parts of speech. As in the big syllabus, the vast portion of parts of speech. Clear? See the next one, conquered. So next topic is conquer. What is conquer? Conquer. Conquer is nothing but an agreement between subject and verb. If the subject is singular, verb is singular. Subject is plural, verb is plural. That is conquer. So another topic is conquer, an agreement between subject and verb. If the subject is singular, verb must be in singular. The subject is plural, verb must be in plural. Clear? So example, she is a teacher. They are children. Clear? Here subject is singular, so verb must be also singular. So sentence is correct. Here they is a plural, are also plural. So sentence is correct. But examination sometimes is given here. So is wrong. Are is correct word. So the agreement between subject and verb is called conquered. That is called important topic, conquered. See, next topic is yes, active voice and the passive voice. Another most important topic is active voice and passive voice. What is active voice? What is passive voice? We express in a sentence in two ways. It is called active and passive voice. Suppose she eats a mango. Small example, sir. Actually, fundamental structure of English also, fundamental sentence in English also, it is called. Fundamental sentence in English has, the sentence must have subject plus verb plus object. It is the fundamental structure of the sentence. A common sentence has three parts of it. The first one is subject. Second one is verb. Third one is an object. Clear? A common sentence has three parts: subject, verb, object. So that is called the fundamental structure of English. It is called subject, it is called verb, it is called object. You know very well, sir. Verb has generally three forms: V1, V2, V3. Suppose eat is a V1, V2, V3. Verb 2 of V2, ate. V3, eaten. Write, wrote, written. Sing, sang, sung. So many words are there, sir. See, simple. What is active voice? What is passive voice? If the subject starts with sentence, if the sentence starts with a subject, it is called active voice. If the sentence starts with an object, then it is called passive voice. So here importance is given to subject, it is called active voice. Here importance are given to object, that is called passive voice. Simply, how can you identify the active voice and passive voice? See, simply you can identify the sentence is in active voice. How can I identify, sir? If the sentence is in the structure, that is called active voice. The structure of active voice, subject plus verb plus object. Clear? The structure of passive voice is object, be form, V3, by, and subject. It is the structure of passive voice. How can you identify the sentence belongs to active voice and passive voice? By seeing structure. Clear? If there is a subject plus verb plus object, then it is called active voice. If there is an object plus be form, V3 plus by plus subject is called passive voice. Clear? Simply, sir. Simply saying, if the sentence starts with subject, then it is called active voice. If the sentence starts with object, then it is called passive voice. Clear? Here example is, she eats a mango. Clear? When you want to change a sentence from active voice to passive voice, simply there are three rules. First of all, subject become object, object become subject. Verb splits into three forms, B form and V3. When you write V3 in passive voice, it is easily followed by the preposition by. Clear? When you want to change a sentence from active voice to passive voice, you must follow these three rules. What is the first rule? Subject become object become a subject. Verb splits into B form and V3. V3 is immediately followed the preposition by. See, first of all, it is called active voice. By using this table, you write the passive voice. What is the object, sir? A mango. In passive voice, object must used in front of the sentence. So verb splits into two forms. Verb is two forms. What is the B form and B3? So B forms must be used based on tense. The sentence is present simple. So must be used mango is. What is the V3 form? Here V3 form eaten. When you write V3, is immediately used by. What is the object of she? Her. Clear? So simply you can change the sentence from active voice to passive voice by using this table. I will give you complete explanation at the time of topic explanation. Right, see. One more, sir. So it is the most important topic of English, active voice and passive voice. Now you see direct, indirect speech, nothing but reported speech or narration. Next topic, direct and indirect speech. Direct and indirect speech. What is direct speech? What is indirect speech? Suppose, I will give you an example. She said, I am busy now. She said, I am busy now. What she said? I am busy now. Actual words of the speaker are as it is repeated on the board. That is called active voice. That is called direct speech. Without repeating the exact words of the speaker, I express my own words of his words. It is called indirect speech. Clear? See, what is direct speech? What is indirect speech? Clear? What is direct speech? Actual words of the speaker are as it is repeated. Right. Is called direct speech. Actual words of the speaker as is repeated. Without repeating his words or her words, I express my own words. It is called indirect speech. So without repeating suppose, I told you one example, sir. She said, I am busy now. I am busy now. It is the actual dialogue, original dialogue heard, original dialogue speaker. What she said, the dialogue is, I am busy now. Actual words of the speaker as is repeated on the board. It is called direct speech. How can you identify the sentence belongs to direct speech or direct speech? If the sentence is inverted commas, the sentence belongs to direct speech. If there is no punctuation marks, that is called direct speech. Simple. How can you identify the sentence belongs to direct speech or indirect speech? Simple. If there is a sentence is inverted commas, the sentence belongs to direct speech. If there are no inverted commas, the sentence belongs to indirect speech. Simple identification. Clear? See, So indirect speech. She said that I become her. She was busy then. So it is called indirect speech. How can it be changed? See, here I can be changed as a she. A verb is changed as was. Time and place may be changed in then. Clear? Pronoun must be changed. Verb must be changed. Time and place also changed. So according to rules, we must follow it. Clear? Right, sir? So one of the important topics. Up to now, we discussed tenses, active voice and passive voice, direct indirect speech, and a question tag. Right. Another topic is question tag. What is the difference between a question and a question tag? Suppose, are you going to college? It is a question. Are you going to college? Is a question. Are you? Aren't you? It is a question tag. The shortest form of the question is called question tag. It is a complete question. The short form, it is called question tag. The shortest form of a question is called question tag. Clear? Right, sir? Question tag. The structure of question tag is helping verb and pronoun. Every question tag must end with question mark. Here, positive sentence or depends on sentence, helping verb. Depends on sentence, not is used or not. Clear? It is a structure of question tag. Okay. See the next model, one more example. Okay. So active voice and passive voice, direct indirect speech, and the question tag. If clause are the most important topic, conditional sentences. So conditional tenses, the most important topics of English in the syllabus, conditional tenses. So simply it called as if clauses. Clear? If clauses. Actually, before discuss this topic, clause. What is clause? Here clause is two types. Subordinate clause main clause. Clause is nothing but a sentence. Clause is nothing but a sentence. Okay. Here two types of clauses, subordinate clause and main clause. Main clause gives complete sense by itself. Subordinate clause does not give complete sense. For full meaning, it depends on main clause. Clear? Suppose, small example. If you work hard, you will get success. You will get more marks. Small example, sir. Suppose, before comma, the sentence is what? If you work hard. If you work hard, what is the meaning of if you work hard? Is it completed? No. If you work hard, incomplete sentence. Incomplete sentence does not give complete meaning. It is called if clause. Nothing but subordinate clause. So subordinate clause does not give complete sense or complete meaning. But you will get more marks. Generally, I will say to you, you will get more marks. You will get success. So it is complete sense, complete meaning that is called main clause. An examination point of view, how they ask questions. For example, if you work hard, Suppose you get more marks. There is no will here. There is no word will here. It's wrong sentence. You must use simple future structure. So simply, if clause is simple present, main clause must in simple future. Must be. If clause is in simple present tense, main clause must be in simple future. We must use we or shall or can or may. We don't use would. We don't use should. We don't use could. We don't use had. We must use always simple future verbs. Clear? I will give you practice sessions. Don't worry. We also discussed previous questions also. Clear? Right now. So one more topic is right now. Right? Active-wise, passive-wise, direct speech, if clauses, question tag, and one more, degrees of comparison. Degrees of comparison. See how you know very well. The verb has three forms: V1, V2, V3. Present verb, past verb, future, past participle. So verb differs from tense. You know very well, sir. Verb has three forms: present verb, past verb, future verb. Suppose verb has three forms, you know, sir. Yes, I told you, sir. Write, wrote, written. Sing, sang, sang. Do, did, done. Dig, dug, dug. Swear, swore, swore. You know very well, sir. Verb has three forms. In the same way, adjective also three forms. Positive degree. Comparative degree. Superlative degree. Clear? Positive degree, comparative degree, superlative degree. Clear? See some example. Positive degree is used, we are talking about the one person in the classroom or anything else. But comparative degree is comparing for the two persons or two things or two objects. But superlative degree is used more than two persons, more than two objects. Clear? Once again, positive degree is used, we are talking about the only one person or one object. We are talking about positive way, not negative way. And the comparative degree is used when comparing with two persons, between two persons. But superlative degree is used more than three persons, more than two persons, or two objects. See, for example, suppose superlative degree. How can you identify the sentence belongs to comparative degree or positive degree or super? The superlative adjective must ends with est, est or st. Comparative degree adjective ends with r, er. Suppose adjective tall or clever. It is a positive degree adjective. er is added to tall or er is added to clever. That is called comparative. Cleverest or tallest, it is called superlative. There is the difference between the words comparative, positive, and superlative. See some example. One example. See, superlative degree, comparative degree, positive degree. Mohan is the tallest boy in the class. Mohan is the tallest boy in the class. Tallest means superlative degree is used. We are comparing more than two persons, entire classroom. Suppose in the classroom there are 100 of us there. Out of 100 persons, he is the tallest. That's why superlative degree is used. What is comparative degree? Mohan is cleverer than any other boy in the classroom. Here, adjective plus than any other, we can identify the sentence belongs to comparative degree. Positive degree, we are talking about positive way, about the person. No other person in the classroom is as tall as Mohan. Clear? In this topic, there are some fundamentals are there, some grammatical rules are there. By using this table, we can easily learn this entire techniques of comparison. Clear? What is superlative structure? What is comparative structure? What is positive structure? See, simple sir. Superlative degree structure, comparative degree structure, positive degree structure. By following this structure, we can write enter three types of sentences. Suppose the plus adjective, if you find the structure, the superlative. Adjective plus than any other. If you find this structure, the sentence must belongs to comparative. No other. So adjective as or as adjective as. Clear? By seeing the structure, we can find the sentence belongs to either positive degree, superlative, or comparative degree. Clear? So it is about degrees of comparison. Clear? Next, vocab. Vocabulary. Vocabulary topic consists of synonyms, antonyms, one-word substitutes, idioms and phrases, phrasal verbs. Clear? Vocab. See, vocabulary, this topic includes synonyms, antonyms, one-word substitutes, surrogate words or one-word substitutions. Idioms and phrases. And phrasal verbs. So these are all topics under vocabulary. Clear? Right. Some important techniques to learn vocabulary: root word technique, flashcard method, words often confused. See, some important techniques to learn vocabulary. Techniques to learn vocabulary. First one, root word technique. What is root word technique? Suppose there is a word side. What is the meaning of side? Yes, kill. What is the meaning of graph? Right. What is the meaning of ambi? Both. See some example. What is the meaning of spect? To look. Suppose, by using this small root word, we can derive so many words. By using the root word side, we can write more than 20 words. What is the meaning of side? Kill. Suppose, side. Suicide, fratricide, sororicide. What is the meaning of suicide? Killing oneself or killing herself or killing himself. Fratricide, killing brother. Sororicide, killing sister. Siblicide, killing siblings, either bro or sis. Siblicide. Uxoricide. Mariticide. Weedicide. Regicide. Homicide. Genocide. Infanticide. Insecticide. So many words we can derive by using small root word side. We can derive more than 20 words. Suppose suicide, killing oneself. Fratricide, fraternity, killing brother. Sororicide, killing sister. Siblicide, killing siblings, either bro or sis. Uxoricide or oxicide, killing wife. Mariticide, killing husband. Weedicide, weeds, herbs. Regicide, killing king. Homicide, killing human beings. Genocide, racial group. Human races. Infanticide, small young ones. Infanticide, insecticide, insects. As well as graph, biography, autobiography, calligraphy, cacography, so many sir. Graph means to write. Biography, autobiography. Self-history, autobiography. Written by others, autobiography. Biography. Ambi means both. Spectacles, watching glasses. Introspection, retrospection, prospective. Spectacle means to look. So, number of words are there, sir. I will give you 50 more than 50 root words. Clear. So, this is called root word technique. Then what about the second one is words often confused. Confusing words. See. Confusing words. Either two or more than two words are pronounced similarly, but the meaning is different, spelling is different. Suppose, adapt, adopt, adapt. Small, it is different. Entire word pronounced similarly. Adapt, adopt, adapt. Suppose, naughty, naughty. What is adapt? What is adopt? What is adapt? Adapt means adjust. Adjust. She can adapt herself to any kind of atmosphere. Then whatever adopt? Adopt means make one's own. The old couple adopted the child from orphanage. Then what is adapt? Skillful. Virat Kohli is adept in batting. The old woman is an adept in storytelling. So many examples. Adapt means adjust. Adopt means make one's own. Make one's own. Adapt means skillful. Okay. Skillful. What is naughty? What is not? Not means type with go. Naughty, tricky. 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 Then what about naughty? Mischievous. Mischievous. Simply, a naughty boy gave naughty problem to the teacher. An example. So many examples are there. So in this way, confusing words. Idle, idle, ideal. Idol means statues. Vinayakas idols. Ganesh idols, statues. Idol means lazy. Idol means role model. Model. He is an ideal person. Idol. She is an ideal lady. And idol. Hindus pray idols. Statues. So many examples are there, sir. In this way, confusing words. Or flashcard method means we are learning daily 5 or 10 words in the newspaper or a novel or by seeing social media, anything else. So daily routine method. And one more, other topics is rearrangement of sentence, scrambled sentences, reading comprehension. When you come, for example, you have command over vocabulary, you must easily identify the reading comprehension passages and rearrangement or scrambled or jigsaw sentences. So other topics are rearrangement of sentences, scrambled sentences, jigsaw sentences, rearrangement, and one more, reading comprehension. And one more, close test. So these topics are explained by seeing passage, like for example PPTs or a paragraph on the board. So reading comprehension and rearrangement sentences, close test. So these topics you can easily understand when you have command over vocabulary. Clear? So correction of sentences. Correction of sentences. So correction of sentences is not only one topic, sir. If there is any error, if there is error in any topic, with a noun topic, pronoun topic, one-word substitutes, a grammar, vocabulary topic, or passage topic, any topic, there is an error, you can identify and you can correct it. That is called correction of sentences. See some example. Where is my spectacles? Small example. Wait. She is married by him. In this way, the sentence is given in the previous examination. Actually, these two are wrong sentences. How can you identify the correct one? See, where is my spectacles is wrong sentence because what? I told you, sir. What is conquered? What is conquered? The agreement between subject and verb. If the subject is singular, verb is singular. Subject is plural, verb is plural. Suppose here, spectacles is a real subject, is a plural subject. The verb is singular, he is given. So it's wrong sentence. Answer is what? Where are my spectacles? Is correct one. She is married by him. Is wrong sentence. Actually, here married followed by to preposition. It's correct one. Clear? So in this way, we can explain each and every topic in the detailed explanation. After completion of every topic, I will give you practice session and practice question will also be discussed here. Clear? Thank you. Thank you so much. Okay.
So they all will guide you in a proper way to achieve the success. Okay. So now let us go to the medical device rules. So this is very important. Okay. Yeah. Coming to the medical device rules. Okay. So these medical device rules introduced in 2018 January. Okay, January 1st. So that I'll tell you. And overall గా మనకి మెడికల్ డివైస్ రూల్స్ లో ఫార్మ్స్ లో రైట్, సో ఏ ఫార్మ్స్ ఇంపార్టెంట్ రైట్, అండ్ విచ్ ఫార్మ్స్ ఆర్ కమింగ్ ఇన్ ద ఎగ్జామినేషన్, విచ్ రూల్స్ ఆర్ very important for the main purpose, so and exam point of view. I'll tell you overview, not in detail. So let us go to the presentation, right? So yeah, so coming to the notification date. Okay, so key legislations and notification date is, so January, yeah, so January 31st 2017, the notification date of medical device rules 2017. So and then effective date, it is January 1, okay, January 1 2018. These are also very important, so we need to understand the basis of each and everything, GO, and when it came into effective, okay, and when it is passed, like that. Okay, so as per rule 1, okay, rule 1, so the effective date is January 1 2018. Okay, then legal authority. Who is the legal authority, right? So legal authority is made under section 12 and 32 of the DC Act. Okay, so ikkada DC Act ostadi manaki important. Okay, so DC Act is very very important. We are very well known about DC Act, but here, so DC Act, in DC Act where this medical devices is incorporated is also very important. Okay, this is the basis of medical device rules. And then what is the primary objective of this medical device rules? So to regulate medical devices under the Drugs and Cosmetics Act framework. This is the only aim of the medical device rules, to regulate, okay, the medical device under DC Act. Okay, so that is very very important. So like this we will go to the forms. Okay, so these are all forms which are very important. Overall forms I explained in this slide, all rules. Okay, so there are almost 83 rules are there. Okay, so 83 rules are there. So in this 83, rule 1, rule 2, rule 3 we will call like this. Okay, rule 1, rule 2, rule 3, like that. Rule 83 is there. Okay, so I have divided these rules into based upon the category. Okay, based upon the category, and this slide is very very important in the examination point of view. I am giving you assurance from this slide, at least you will get 2 to 3 questions directly if you are if you for the exam point of view. MD11 so many times in the 2018 medical device drug inspector examination and other drug inspector examinations, this question has arrived so many times. Okay, then MD12. Okay, so MD12, import of license for sale. Okay, so import of license for sale, MD12. And MD13, this is for clinical investigation. MD14 is the import, but this is MD13, form MD13 is clinical investigation. And MD22 is application for clinical investigation. MD22 is application for the clinical investigation. MD39, testing laboratory registration. Okay, for the registration purpose, you have to follow this form MD39. Okay, then MD34. So this is order not to dispose of stock. Okay, MD34. And coming to the MD2, okay, medical device form 2 is just registration. Okay, notified bodies registration. Okay, notified bodies registration. So in this you have to follow manufacturing license, import license, A form, which forms are important, you have to concentrate on this. Okay, in detail anyway I will tell you in the upcoming classes, don't worry. Yeah, next coming to the other important information about the medical device rules 2017. So here, so what qualifies as a medical device? Which one we call it as a medical device? We need to understand the concept of medical device, right? And do not get confused. As I explained, even though it is a medical device, if you are giving with the drug is involved with the medical device, it will not come under medical device. Okay, there are certain exemptions are there. So here I have mentioned clearly. So it is mentioned in the medical device rules also, excluded, important exclusions are there. Even though it is medical device, in certain cases medical device drug inspector or medical device rules cannot monitor, cannot regulate that condition. That will be regulated by other acts like DC Act. Okay, and there are so many other acts which will regulate the medical device in certain conditions. There are certain important exclusions are there. It is in the rules. It is clearly mentioned. Okay, medical device and what are the main conditions they exempted. Okay, that I'll tell you what are the importance. So mainly built the medical device rules and they categorize different devices into medical device. Number one, in vitro diagnostics, substances used for in vitro diagnosis, including reagents and testing kits, and then surgical supplies. Okay, surgical dressings, bandages, staples, sutures, ligatures, and related materials. So this will comes under medical device. Suppose example, medical bandages. Okay, medical bandages or medical dressings. Okay, so those will not comes under medical device in certain conditions because drug is involved over there. There is an exemption. It is mentioned in the rules. If it is in the case of combination of drug, that will not comes under medical devices. But if you type in the Google, medical bandages are comes under medical devices, yes, it will say yes. So don't follow the Google information. Follow the medical device rules 2017 PDF is there. I'll share this PDF in the below link. Okay, you can go through that. It is available in the CDSCO website also, and you can go through that PDF. From that PDF, I have made this particular presentation, right? And then blood collection. Okay, so blood and blood component collection bags with or without anticoagulant. If it is with coagulant, then it will not come under medical device. DNC Act will take care of that. Okay, so without that drugs, then it comes under medical device. Then contraceptives, medicinal contraceptives including condoms and IUDs and tubal rings. So this will comes under medical device. But if you are adding some drug with the contraceptives or some other purpose you are using, that will not comes under medical device. Then disinfectants and insecticides notified under section 3B(2) of Drugs and Cosmetics Act. These will comes under medical device, and other components are there, so many reagents are there, they will monitored by the DNC Act. Okay, so these are the important various types of medical device and category of medical device. 2017 rules will included, and then there are certain important exclusions, and that will be taken care by other acts. So this we have to understand properly, otherwise we may get confused. What circumstance, the question asking in which circumstances. Okay, yes, medical device, but in some circumstances, if in some conditions, we have to follow, we have to carefully answer that question. Okay, and then next, yeah, classification of medical device. So there are different classes are there. So class A, low risk, and class B, low moderate risk, and class B, moderate risk, and class D, high risk. So there are four categories in medical device, A, B, C, D. Okay, so A, B, C, D. So examples. So class A, low risk, thermometers, surgical gloves, wheelchairs. Okay, so these devices require minimal attention. Okay, so minimal potential for harm to the user. That will comes under class A, low risk. Then class B, low moderate risk. Then class C, moderate to high risk. Then class D, high risk. Example, cardiac stents, implantable device, heart valves, highest risk requiring most stringent regulatory controls. Here example I tell you, cardiac stents. Okay, so in the exemption it is mentioned that the cardiac stents which are given in the presence of drugs, okay, which will be given to the patient in the presence of drug, that will not come under medical device, and in that condition DNC Act will take care. Okay, so like that. So the condition, in a question, what condition they are mentioning, we need to carefully read the question, then only you are able to answer. Okay, and then classification criteria, how they classified. So intended use and purpose, based upon the use and purpose, they classified the class A, B, C, D, and then duration of contact with the body, and then degree of invasiveness. Based upon that, they classified this medical device. And the other important categories, the conditions they have taken care, local versus systemic effect. Okay, local versus systemic effect based upon whether it is local or systemic. So if it is systemic, it is high risk. They comes under a different class. And then diagnostic versus therapeutic purpose, whether it is diagnostic purpose or therapeutic purpose. Based upon that, low risk or high risk they categorized. And then potential for harm to patient. Okay, so how much harm it is if you are using without information or in the presence of any technical person is required or not. So based upon that, they classified this medical device into 4 categories, A, B, C, D. And in exam point of view, you must understand the classification determines regulatory requirements. Okay, high risk classes require more stringent controls, documentation and oversight. So that's why we need to focus on high risk, at the same time low risk also, but high risk are very important. In the exam point of view, the maximum times they are asking this high risk one. Okay, so you have to focus on high risk. And then coming to the manufacturing license requirements, rule 20. So we are discussing, so these rules, some of the rules we'll discuss in this presentation. So rule 20, okay, so here manufacturing license requirements mentioned in the rule 20. So what are the requirements for the manufacturing license? So we discuss MD11, okay, this is form, this is rule, very important, don't get confused. Form is different, rule is different, okay. So I already clearly mentioned, right? So coming to the application documentation, what are the requirements to get manufacturing license? So first, application, complete application is required with all the required documents specified in the 4th schedule. Okay, so 4th schedule also involved here, very important. Okay, 4th schedule. And then coming to the manufacturing details, comprehensive details of medical devices which you are going to manufacture, okay, to be manufactured, and including classification and intended use. You have to mention what is the use of that particular medical device. And then site and staff information, what is your site, where it is located, and what are the infrastructure you have, and then information also, okay, staff information also, how many staff you have, okay, what are the qualifications of the staff, everything you have to mention. And then quality systems, quality management, this is what I am talking, okay. Quality management system, very important in point of medical device rules. Okay, so system documentation, design control documents, and risk management data. So we have to maintain all the data according to the medical devices rules. You have to maintain each and every data. So in medical devices, documentation is very important. So I talk to my friends, drug inspectors, they always tell there is so much documentation is involved in this. Okay. So they are worried about document because documentation is very important. This is more important than the inspection. So inspection, while you are inspecting, okay, what you have inspected, what you have observed, you should note it down. Otherwise, we may forget. As a human being, anyone can forget. So that's why they always tell me. So yeah, we are working much on documentation, and it is important for the system. Okay, yes, I appreciate all of them, right? And then next, coming to the critical provisions for compliance. Okay, so the manufacturing site must be ready for the audit and shall comply with all provisions and Drugs and Cosmetics Act. Ikkada manaki DC Act 1940 vastadi madhyala. So where it will come and where it will involve, you must remember. Otherwise, you may get confused. Okay. Then what is the license validity? This is a very important question. So many times it's asked in the DA examination. Okay. License validity. This manufacturing license validity is only 3 years. Repeated question in the drug inspector examination. Okay. So 3 years. Documentation, validity period, and the specific form number, that is MD11. Documentation, validity period, and MD form always asking in the examination. These areas you must focus. Okay. So yes. Next, coming to the import license requirement, that is in Rule 22. Form, rule are different. Okay, you must focus. You make a table in your notebook, separate forms and separate rules. Okay, very important. So coming to the sale and distribution, MD12. Okay, MD form 12, it is sale and distribution. For clinical investigation and test evaluation, Form 13, okay, for clinical investigation. And next, complete application is comes under, so universal requirements for both license type. So clinical investigations ki and sale and distributions ki ఏమేం రిక్వైర్మెంట్స్ కావాలి, సో నువ్వు ఇన్వెస్టిగేట్ చేయాలన్నా లేకపోతే సేల్ చేయాలన్నా వాట్ ఆర్ ద డాక్యుమెంట్స్ ఆర్ రిక్వైర్డ్. సో హియర్ క్లినికల్ ఇన్వెస్టిగేషన్ అండర్ ఫార్మ్ MD13 and sale and distribution and MD12. Okay, this is very important. And next, complete application. First, you must have complete application for both licenses, and then second, device classification. Which classification your device will comes. That is also important. And then fee payment. You have to pay the fee of the prescribed fee with proper documentation. Okay, and then compliance undertaking, written undertaking to comply with all applicable rules and regulations. You have to give compliance also. And in exam point of view, you must focus validity periods, and commercial import license have different durations compared to the clinical investigation license. So clinical investigation license emo manaki only 180 days untadi, means 6 months untadi. But దాని manufacturing license వచ్చేసి మనకి 3 years ఉంటుంది. It will be 3 years. So please focus which point, in which context they are asking the question. This is very, very important. Okay. So clinical investigations valid only for 180 days, 6 months, and manufacturing license will be valid for 3 years. Okay. Next. So these are the different QMS system. Very, very important. So many times they are asking the examination. So what are the requirements? Documentation is always important. Okay. So comprehensive documentation in the form of device master file with all required technical specifications. All specifications you must mention, and you have to document everything. Okay. And then design controls, systematic design control procedures covering input, output, verification, validation process. Everything you have to document. And then CAPA system. This is also important in the exam point of view. CAPA system, corrective preventive actions system for continuous improvement and problem resolution. Okay, corrective and preventive actions systems, okay, for continuous improvement and problem resolution. CAPA system is important. And production controls, you have to mainly focus on the production controls, production and process controls with quality assurance procedures throughout the manufacturing. Then risk management, comprehensive risk management system, identifying, analyzing, mitigating potential hazards. This is also very important, which will comes under Rule 8. And then essential technical documentation, design input and output documents, mechanical and electrical test reports, everything you have to submit. Okay, electrical reports also you have to submit. It should pass the test. And then reliability and performance test data. Then software validation if applicable. Okay, so if you are using some software to that particular medical device, then that software validation is also important, and you have to document that. And then ex vivo test data results. Okay, ex vivo test data and then results you have to show. And then clinical investigation data. So in this QMS point of view, they are asking so many questions. Okay, please focus on this area. And then exam point of view, questions often focus on required elements of QMS and specific contents of the device master file. Master's file lo eme undali. What are the parts of the master file? So you have to focus on this. Okay. So next, coming to the regulatory framework for clinical studies. Okay. So prior permission is required. Regulatory studies. Prior permission is required under Form MD22 for regulatory framework, and then ethical committee approval also required. Okay, qualified principal investigator should be there, and then investigation plan. Okay, comprehensive clinical investigation plan with the detailed protocols and risk benefit assessment. Okay, and then required documentation and forms. So here we will see the important forms for regulatory framework for clinical studies. So generally we will focus on the clinical studies because it is very, very important. MD22, Form 22, application for clinical investigation, and this is validity is very, very important. In exam point of view, validity they are asking. So MD22 form, okay, so it's application for clinical investigation valid for only 180 days. That's what I'm telling in the previous slides. Okay, then MD23, permission for clinical investigation, that is application, and this is a permission. validity as granted. Okay, and then MD24. So there are so many rules, but so many forms. So just we'll focus on the important forms. MD24, application for the clinical performance evaluation. Okay, and then permission for the clinical performance evaluation. So this is 180 days and this is granted, right? And then critical requirements for the clinical studies. Device details are very, very important, and site information is important, and principal investigator details, what is the qualification, and then informed consent also finally important. These are the important parts. In the examination they will ask, what are the below mentioned parts are required for the critical requirement for the clinical studies. So they mention among all three they'll miss one thing, or you find out, or they will mention any of these four. So like that you must remember what are the main parts or main critical requirement for the clinical studies. Okay, and then coming to the testing and evaluation rules. That's what I am focusing in this class, only important areas. Okay, so in coming classes then we will discuss in detail, okay, and with proper explanation, right? And testing and evaluation, it comes under rule 71 to 83. Okay, so medical device testing laboratory requirements, that is registration is required, and inspection and approval. So drug inspector will go and inspect the site and they will approve, right? And then what are the main things? So first, registration required. So all testing laboratory must be registered with the CDSCO before conducting medical device. They must register. And then application process, they should apply to the CDSCO through the online website. Okay, and then so that is form MD39 with complete facility and personal details, and then inspection approval. So once you submit the application, they'll come for the inspection and they'll approve. And then standards compliance. So must comply with all applicable national and international testing standards. So you must, the site should be comply with the national and international standards, right? So next, testing documentation required. So testing standards, you must show testing standards. And then test reports, you must submit the reports. What are the reports from that particular device? Okay, results must be comprehensively documented. Follow prescribed format. There is a format given in the form MD35. Okay, form MD35, and include methodology and conclusions. And then key forms for testing and evaluation, MD34, 35, 39. So these are the key forms for the testing and evaluation, right? So this is important information which comes under Medical Device Rules 2017. So mainly you have to focus on forms which are important forms, and then the important rules. Okay, so if you follow or if you try to remember 1 to 83 rules, you may get confused. Okay, you may remember, you may study, but mainly focus on important rules which explained in this presentation. And then forms. Yes, there are 45 forms are there. We call them MD form 1, MD form 2, like that, MD form 45. Right? In that, which forms are important, I explained. So you go through that forms, okay, and then first important forms you understand and try to remember, because every time they are asking the examination, and then anyway you will read all other forms also. Okay. Okay, so this is what the medical device rules and 2017 I tried to segregate, okay, into different parts. So if you go to the CDSCO website, there is only one PDF, complete PDF. If you start reading that PDF, and if you come to its 15th page, you may get confused. Okay, so this help is always required from the experts. So that's why we are here to help you. Okay, if you are okay with the particular PDF, you can go ahead. Okay, so we are starting new batch for this. Okay, and in the down we have mentioned the WhatsApp group details and Google forms. Those who are really interested, please fill that form and join in the WhatsApp group. I'll give you the details, and the continuous consistent efforts will be there till November 2nd. Okay, so by October 20th we are going to finish the syllabus, because all team is ready. Okay, so from last 1 week we are working on the syllabus and different classes. Okay, number of hours. So everything is set. So we will start with the classes, and classes will be morning and evening will be there. We will announce in the batch once we announce the batch. Okay. So the entire setup, the entire coaching will be 160 to 200 hours. Okay, so per day we will spend 3 to 4 hours. Okay, so we have almost 40 days, October 20. So we have 40 days, till that 40 days we'll spend. Then after October 20 we will go with the mock test and paper discussion, and this is what we want to convey from our side. And this overview will be in English for now. Okay, so English, this overview is, English is there, but in coming classes it will be bilanguages. Okay, so based upon the student requirement we'll go with that. Okay, and mainly important you have to remember is medical device rules 2023 also very important. Okay, so they have amended and they have modified rules in 2023. That also I'll explain in detail in upcoming classes. Okay, so that's what I'm telling. This is just overview, and in upcoming classes you will be taught everything. Okay, that 2023 medical device rules, and mainly we are also focusing on the different softwares which are used by CDSCO. That also I'll tell you which platform they'll use, and then in that what are the main specific requirements are there. So that's what software details also will go through. Okay, that is also important under medical device rules. So this is how we'll go with the another upcoming 40 days, and be with us. If you're really interested, share this particular video to others, and also subscribe. We're always putting content related to pharmacy, and the MCQs also there. Every time we'll post MCQs, different MCQs from the pharmacy. And the important thing is we will also conduct a general studies exams also. Our team is ready with the exams, because they are expert. They are expert because they taught at different levels, UPSC levels. Okay, Shine India. Okay, and then different RRB exams they have taught. So that's why they are coming, and they teach you the general studies concept, and we will teach you, the pharma faculty will teach you in the medical device rules. So this is what from my side, and if you need any help, please you can contact us, you can comment, and you can contact me, and it is available. We will give you the information, entire information in the description, and you can follow that information and get utilized. We are here to help you. Okay, so if you need any help, please contact. So this is what about medical device rules 2017, and about 2023 we'll discuss later. Okay, so in upcoming classes. Okay, so yeah, this is what today's session, and thank you for watching, and please share this video with others, your friends, and if you are really interested, you join in our WhatsApp groups, and then Google form also mentioned in the description, in the comment section. You fill that Google form, and we are here to help you. Our team is ready.